Welcome. So I'd like to talk a little bit about the role of traumatic memories in PTSD. So typically visual memories are processed naturally by the mind, and they undergo certain changes in their properties over time. So typically a memory will start off large and intense in detail and color, and will seem very close, but over time the image becomes smaller in size. It seems to become more distant. There's a spatial reorganization of its position in our visual memory, and it loses details and becomes more fuzzy in effect. So this is a natural process by which the mind processes visual imagery. Now, in the case of traumatic imagery, this process doesn't happen. So the traumatic imagery remains at its original level of intensity in the mind. It remains very large, very close, typically very high in the psychological visual field, and very intense colors and details and other properties that essentially keep that experience alive, because imagery is the primary way that the mind organizes emotion. So intense large imagery will create intense large emotions. So the primary issue that we have to deal with when we're working with PTSD or any other kind of traumatic or disturbing intrusive imagery is to find ways of reprocessing the imagery, helping it resolve itself in this natural way. The typical kind of ways that we can examine to help it resolve is to make it smaller, to make it further away in how we see it in the mind, to change the color of the imagery, often changing it from intense color into black and white can have quite profound effects on the emotional intensity of the image. So we have to do this consciously, and that is where mindfulness comes in. So the way we do this is that we mindfully meditate on the traumatic image, look at its details, and then start exploring changing the details of how we see that image to help it resolve. We often describe this as helping to digest the sensory overload that is encoded in that imagery. So that's something I have termed mindfulness-based image reprocessing, and that's very much a part of my approach to working with PTSD. If you would like to learn more about this and about how to work with traumatic imagery and intrusive imagery that you may be experiencing, then please email me and let's schedule a therapy session via Skype, and I will teach you how to work with your traumatic memories and imagery using the mindfulness-based methods that I have developed and found to be very effective. So please contact me if you'd like to learn more. Thank you.